community of practice on gender and health. Just to let you know, this webinar is being recorded and live streamed. I'm Joanna Riha. I'm the research lead for gender equality and intersectionality here at UNU-IIGH, and we'll be introducing the webinar today. I wanted to begin by introducing the community of practice. This webinar is part of a series that the community of practice hosts, but I think it's important from time to time to revisit what the community of practice is about, why it was set up in the first place. So if you'll allow me a few minutes, I'll tell you a bit about the community of practice before we move on to the meat of the discussion today. So the community of practice was formed actually through a partnership with the African Union's COVID-19 Commission Working Group on Gender and Stigmatization, and the School of Public Health at the University of Western Cape, and the Gender and Health Hub here at UNU-IIGH, and has since evolved to include other organizations, including Pandemic Action Network and PATH. The community of practice was set up to really facilitate a space for program implementers in the health sector, policymakers, researchers, civil society actors, and donors to engage in discussions and share ideas related to gender and health broadly on the continent. And the aim was to advance African initiatives to facilitate, cross-regional understanding, collaboration, generation of policy-relevant knowledge and practice, all with a view to improving and advancing gender equality and health. In our last webinar, based on feedback that we received from various members from the community of practice through our survey, we kicked off our webinar series with our very first webinar this year focusing on addressing technology-facilitated gender-based violence to safeguard digital spaces, particularly from an African perspective. In this webinar, we're shifting focus to another topic that many of you had voted for as a priority to discuss, namely climate change, gender, and health. Across Africa, like in many parts of the world, climate change is severely impacting health systems, not only through increased demand for services, but also in terms of disruption of healthcare delivery, infrastructure, as well as competing and constricting investments in the health sector due to competing demands. Despite contributing the least to climate crises, health and health systems across the continent are disproportionately affected and vulnerable. In 2022, it was estimated that across Africa, more than 110 million people were affected by disasters of all types: droughts, earthquakes, floods, extreme temperatures, landslides, storms, wildfires. And this figure accounts for almost 60% of the total affected populations globally. Now, from a gendered perspective, and I think this is where it's really important, it disproportionately impacts women and girls. There's increased vulnerability, in terms of extreme weather events, both related to morbidity and mortality, affecting malnutrition, exposure to waterborne diseases. And these are very much linked to socially constructed roles and responsibilities that women and girls are expected to fulfill. There's also increased food security and malnutrition, especially in female-headed households. When we think about vulnerability vis-a-vis income and having less stable incomes, mental health impacts related to access, restrictions and disruption of services, including sexual and reproductive health services, as well as gender-based violence. And I think if we're thinking about these things in the context of climate change, there has been a lot of work that has been done on climate change mitigation and adaptation. However, there's a realization that we cannot keep firefighting. We need to move beyond immediate response to looking to the future and actually addressing some of the fundamental drivers of inequities and inequalities and drivers of climate change. And so in that way, there's been a call to move towards just climate transitions. And we'll hear a bit more about exactly what those are and what they mean from a gendered perspective. So I encourage you all, as we have this webinar today, to post your questions in the chat. I know a number of you have already sent us in your questions when you registered, so we hope to come to some of those. But do engage in the discussion. We have a fantastic lineup of panelists and an incredible moderator joining us today. And I do hope you enjoy the webinar. So I'm going to hand over to Nachilala Nkombo, who's the founder and co-chairperson of Women Leaders for Climate Action. She's also the country director for Bridges to Prosperity in Zambia. So Nachilala, over to you. Thank you so much.
Thank you so much, Joanna, for that kind introduction. And good morning, everyone. I feel greatly honored and privileged to have been asked by UNU-IGH to moderate this important conversation at such a time when various African countries and communities are facing the severe impacts of climate change, whether we're talking about our state of our food security or our already fragile health system. We also know that the climate change impacts, as ably elaborated by Joanna, are severely impacting the status and condition of women. So I'm really very excited to join all of you today for us to listen to a body of knowledge from a distinguished panel of experts around the mother of all questions. What does a just climate transition mean for health systems in Africa? And why should it be a gender just one? So before I invite the panelists to share with us, I just want to go through some of the key concepts that we are introducing in this webinar so that we are completely aligned. So what does a just climate transition means? A transition is basically a shift. In this case, because we're talking about the impacts of climate change, it's a shift towards net zero. A just climate transition is a shift from business as usual towards a low carbon, resource efficient, and environmentally sustainable economies. A just transition also recognizes that climate impacts affect different communities and population groups differently. They create different disadvantages differently, from how they affect communities that in rural setups, how they affect small businesses, how they affect women. So for the transition to be just, it requires a recognition of those uneven impacts. Within the African context, as we're really facing a multiple crisis, a just transition looks beyond the energy transition. It requires maximizing the benefits of climate action and minimizing the negative impacts of mitigation on vulnerable communities. As communities, they have to move from reliance on fossil fuels to cleaner forms of energy. They are losers and winners, and the just transition requires us to manage the most vulnerable in that process to make sure that they are provided for, their specific needs and priorities are dealt with from their context beyond the energy transition. Lastly, but not the least, a just climate transition means action, but action beyond mitigation. It requires us to combat inequalities, as elaborated by Johanna, vulnerability of communities, and also looking at opportunity. Does every community have the tools and the opportunities for them to protect themselves from climate impacts or to manage the transition? It essentially means building inclusive society where no one is left behind. Next slide. So why does this transition have to be gender just? So a gender just transition is, again, another transformative process that seeks to address gender-based injustices by dismantling power structures, patriarchal and oppressive systems that have historically concentrated wealth and power in a few hands, mostly in the hands of men, in the hands of politicians, in the African context, it's mostly in the hands also of communities that are largely of European descent. Why a gender-just transition? As mentioned by Johanna, women are carrying the burden of the impacts of climate change. So the climate crisis is essentially a gender crisis. So for us to win in building a gender-just, a climate-just future, we really need to make sure that we incorporate gender equality principles at the core of the transition. According to the United Nations, climate change has worsened existing gender inequalities. By 2050, climate change will push another 158 million more women and girls into poverty. So a gender-just transition calls for structural changes at a broader economic, social, looking at the broader economic, social, and political drivers of inequalities that intensify the impacts of climate change. It actually requires us to relook at the impacts of the macroeconomic policies that we have in our countries, but as well as the sectoral policies, and to what extent they're taking into account the gendered impacts of climate change. A gender-just transition calls for us to challenge existing power structures, ensuring solutions that are put on the table to address our planetary crisis are inclusive, equitable, and gender-just. And this is part of what the distinguished panel is going to help us unravel and unpack so that we can actually build the body of knowledge as African communities on how to respond to this crisis without leaving anyone behind. However, whether the transition is happening in Malawi, in Senegal, or Eswatini, there are certain common principles that characterize this transition. So at the core of the gender-just transition is a prioritization of certain key principles that characterize the structural change. It requires shifting power to communities. So for example, shifting power from national capitals to communities where the natural disasters are happening, giving them the resources, giving the tools, giving them the early monitoring systems so that they can devise the solutions that will best protect and secure the communities. It also means that bringing decisions to countries and continents that are most affected and giving African countries, Asian countries, Latin American countries stronger voice in spaces such as COP, because the worst impacts of climate change are felt in those regions. The gender-just transition also recognizes the unequal access to resources, because for any community and any household to be able to protect itself from the impact of climate change, it needs resources. So a gender-just transition addresses the resource question and requires equitable resource distribution for redistributive justice. Redistributive justice that's caused by historical factors, but also that's been exacerbated by the realities of climate change. And again, part of building resilience of communities is ensuring that communities have access to dignified jobs. They have access to decent jobs, because the jobs provide the means and the incomes for communities to respond. Whether they're facing health-related climate issues in their communities, on their homes, they need resources, they need backup, right? And if the majority of the communities are in unsecure, informal jobs, it means they have to depend on the state or charity for them to protect themselves. But if we're working towards a gender-just transition or climate-just transition, we really need to make sure that we are very deliberate in our economic policies to make sure that the jobs that are available for the majority of these vulnerable communities are dignified. As we know, women face discrimination in the workplace, in communities, and it also comes down to employment. So a gender-just transition requires removing gender-based barriers to employment, where an employer would think twice before they employ a woman. It requires the expertise and the unique qualities of women in a workplace, in an organization, to be appreciated. Women contribute a lot. Half the time is that their leadership or their workmanship is not appreciated to the same level as men. So a gender just transition requires us to flip that, to recognize the unique contribution, skills, and expertise that women bring to the workplace. The last principle, but by no means necessary, is really valuing and compensating for care work. When disaster strikes and there's a disease outbreak that has been triggered by climate change, the care burden of women increases exponentially. So what that requires is that as communities and societies, we must factor in, we must budget and build in the value of care work so that when these disasters happen, especially whether at a small scale or at a large scale, the women who carry the burden of care are actually given the right kind of support. So this was just to introduce the two key concepts and the key principles around the gender just transition. But to take us deeper into the conversation is an eminent panel of speakers that are joining us today. I have the rare honor and privilege of introducing Aggrey Aluso. Mr. Aggrey Aluso is the incoming Executive Director of the Resilience Action Network Africa. He currently serves as the Director of the Africa region and Global Policy Lead at the Pandemic Action Network. Good morning and welcome, Aggrey.
Thank you for having me.
Thank you so much. And our next distinguished speaker is the Honorable Jalikatsu Mustafa, who's the Deputy Minister of Health in Sierra Leone. He's an experienced ophthalmologist and a public health leader with decades of experience. So there's no better person than him to explain how the health systems have been impacted and where we need to be looking. Good morning, sir.
Good morning, and it's a she. Thank you. I'm happy to be
I am
here.
so sorry. I'm so sorry. I'm just following what is here. And thirdly, our third distinguished panelist is Ms. Katindi Sivu. Katindi is one of Africa's top female futurists, specializing in foresight research and policy impact. She is a consultant with Longview Consult and Africa Foresight Lab. Katindi, are you with us this morning?
Yes, I am. Hello, everybody, and thank you for having me.
Excellent. Lastly, but not the least, is Hashim Hupatin, who is a medical doctor and public health practitioner. His recent research work focused on health systems adaptations to climate change in sub-Saharan Africa. So, ladies and gentlemen, this is our distinguished panel. Without much ado, I will go right into it and just ask Aggrey to open up the conversation. Aggrey, from your perspective, what does a gender just transition? Why does a gender just transition matter for health systems in Africa? And what is the health system's role in facilitating this gender just transition?
Thank you very much, Chilala, and to our distinguished guest in the call. Yes, so thank you so much for that very elaborate and powerful background that both you and Josephina shared. I think that really captures the gist of what I would want to say. That really, I think it's not just a lot of, for the better part of this conversation on climate, conversations have centered on energy and other things that are deemed important, and health, leave alone gender, has been struggling to even get a space in the the climate discourse or climate change discourse. It's a very recent entrant, and it was only last year that we have Health Day at the COP, and it's been a struggle. Even having a position that really elucidates how the climate change is impacting the health sector is something that has taken quite a lot of effort and energy, for those of us who have been working in this sector to get it into the mainstream conversation. Yet, for many years now, we know that the climate change has been shaping health outcomes We know now with very well informed data sources that the change in the temperature is shaping how pathogens are able to first of all mutate and become more virulent or more impactful in terms of how they affect human lives, in terms of how they jump from one species to another, in terms of how the vectors that carried them, are able to carry them, and the pathogens changing their capabilities to really be more impactful. So that's information that is out there. It's emerging, but very few of our leaders and policymakers really use this information. So therefore, for me, really bringing gender just conversation in the climate discourse is very important, because as you've ably elucidated in your presentation, the impact of climate in health has a very gendered trend. And if we want to understand how this works, I think the point of entry is really to have a very well articulated gender disaggregated data that inform our decisions, so that we know how what's the differential impact of climate change in the health. How is it impacting women? How is it impacting girls compared to men and boys? And therefore, using that information to inform the measures that are taken in terms of, first of all, preventing, because I think the point of emphasis needs to be prevention of actions that are really fueling this climate change, but also at the same time mitigating the impact of that change already, because we're seeing how it's already impacting our health system. And that should be in terms of the policy decision making. That information should inform, but not just getting the data to inform the decision making, but involving actively women and girls in the highest levels of decision making. So that inclusion that you talked about is something that we've been doing a lot in terms of theorization and just in papers. But if you look at how health decision making is structured, it's a very male-dominated space, just like many other aspects of our society, right from the global spheres to our national spaces. Women mostly in the frontline, low cadre, health service provision. But when it comes, very overrepresented in those levels. But when it comes to decision making, we have very low representation of women and girls. So that's another area where we really need that change. And the other thing I want to say is, in terms of how this should inform our decisions, really the institutions that are shaping, health system transformation really need to be gender aware. And that gender awareness is a whole continuum of important inputs, starting from the very well-informed and intentional gender analysis that I talked about, to really being very clear about what gender transformative policies, you talked about that, need to be put in place that respond to the defined climate sensitive health challenges that we are experiencing currently, and how we therefore connect the different relevant departments that should work in collaboration, so that there's that accountability. The women institutions like the one you lead, Nashilala, should be part of the important national policy accountability processes that ensure that important decisions are taken and the implementation takes place. And then the other thing is capacity, building the capacity of these institutions, the health capacity, the health institutions, those institutions that are supposed to do accountability, the women-led and girls-led institutions themselves. We need that capacity building all around, so that everybody is able to play their rightful role. And really, the other thing is integrated research and technology, where we have science informing what we do and not just basing our engagement on assumption. And then last is financing, because that's where the difference is made. A lot of conversations, acknowledge the challenge, but do not put resources. So in our nationally determined contributors, for example, you hardly find help. And you'd hardly find, they're emerging lately, but very peripheral, very, like a third wheel. So you hear a lot of conversations talking about co-benefits, the concept of co-benefits, not like something that is additional, extra, what do you call them? Something that is not intended, but, additional benefit that we should be happy that we have. Whereas we know that the issues that we now face, health is actually the human face of climate change. And we really need to make it the main benefit. It's the issue in the climate change conversation. And the gender dimensions to it are equally the main issue that need to be really considered. We saw that during COVID, how decision-making can be very blind and categorizing sexual reproductive health services as non-essential in a number of countries, leading to very, very dire outcomes for women and girls. So that's, for me, transforming that system would really mean, working across those different levels of issues so that we have a resilient and informed health system that is aware and responsive to the needs as they evolve. Thank you.
Thank you so much, Aggrey, for really delving into, first of all, the status of health as a subject, so important within the overall climate discourse, but also bringing us down to what needs to happen to build a stronger gendered approach to this transition. I think this makes a perfect connection from us to move to Honorable Jalikatu Mustafa Madam as the Deputy Minister of Health in Sierra Leone. We would like to hear from you, just building from Aggrey's comments. He notes that in the NDCs, health is a small issue, and yet when the disasters do happen, they affect the health systems greatly. He also noted the fact that there's still gross under representation of women and girls when it comes to health-related decision-making. So from where you sit, maybe you can share with us how Sierra Leone is doing and what you think are the investments and the measures that need to be taken in the future to have a more meaningful gender-just transition to strengthen our health systems in Africa.
Thank you very much, Nachilala. In Sierra Leone, we're actually living in the reality of the climate crisis right now. So we know that climate change is compounding all our health problems that we face, and it's most really acutely felt by women and children. So for us, like both you and Aggrey have elaborated, it's more than an environmental issue, it's more than an energy issue. We see it as a health issue, but also more specifically a reproductive health issue, a child survival issue, a gender issue. So for us to build a resilient health system, we know that this transition is timely. We need it at the core of our climate response so that we have an equitable health system. So, examples of what we're doing in Sierra Leone and the key areas of investment would be firstly the health system in general. So we're strengthening our health system. We're ensuring that we have comprehensive health centers distributed across the country that are delivering health services, but specifically integrating sexual reproductive health services and adolescent health services, especially for underserved and rural areas. Part of our strategy is a mobile health clinics, mobile health team. These teams provide essential care to women and girls in remote areas, especially climate impacted regions, so that we bring the services closer to those who need it the most. And our health centers in these spaces, we've also designed them to serve as safe spaces, to also provide care for, gender-based violence, mental health support, emergency health systems, especially during crisis. You talked about the importance of making sure women have access to some of these services during emergencies. Also, we're building a robust emergency response crisis preparedness network. You also specifically talked about, early warning systems. So we're strengthening our early warning systems. We recently launched our National Public Health Agency, which is leading this response. It's building an emergency response, one that specifically also prioritizes women's health and that of vulnerable communities during crisis. And we've designed protocols that focus on women's health and reduce the risk of gender-based violence during displacement and during crisis. It's also building on supporting our supply chain for essential health commodities, particularly focused as well on women and maternal and child health care. The health workforce, we're trying to build a gender sensitive health workforce. So like Aggrey mentioned, we're training health workers, especially community health workers at the lower level to respond to the specific health needs of women and girls in communities during this crisis. But also for longer term, we're investing in scaling up women's leadership in health and other related sectors so that the women are central in shaping the policies for health, climate policies, and everything else that affects them, in these communities. We're also bringing in digital health solutions. So we're scaling up tools to ensure that the communities, but specifically women, have access to health information and services that they need, especially during crisis. One thing we're really proud of in Sierra Leone is called Press Track, which is a locally developed app that registers and tracks every pregnant woman across the country from conception all the way through delivery and the postnatal period. So this ensures that these women, regardless of location, socioeconomic status, or whether there's a disaster or not, that they're all visible to the health system so that we can cater to their specific needs. So, these are some of the things we're doing in the health sector, but also as a country, we realize that for any, health policies to be inclusive, to be successful, we have to work on related sectors that are also vital for health outcomes. So like our water and sanitation and energy sectors, we're building reliable wash facilities across the communities. We're making sure these facilities are gender sensitive and they provide consistent access to clean water and safe hygienic services for communities. We know that when we have these disasters, women are the ones who bear the brunt of some of these problems. Energy is also crucial, of course. We're in the health sector in particular, where we've developed a climate adaptation strategy that's ensuring all health facilities have access to renewable energy and sustainable water supply so that we don't have interrupted services, whether there's a crisis or not, and we can keep performing the life-saving procedures. We can maintain cold chains for vaccines, and support some of the digital health solutions that we're building. And using the successes for the health sector, the government is also expanding this to other areas like clean cooking, providing these services in the communities, and we're investing heavily in that. For food and security and nutrition, you in particular talked about how this is important and climate change is exacerbating food insecurity and malnutrition. In a place like Sierra Leone, this is very important because our economy and also our population is heavily reliant on our local agricultural sector, and climate change is affecting this. So what we're doing in Sierra Leone, last year, our president launched a flagship Feed Sierra Leone initiative, which is supporting local farmers with climate smart training and infrastructure, whilst also promoting women-led agricultural cooperatives. For the health sector in particular, we're implementing targeted nutrition programs that prioritize women-led households, but specifically also pregnant women, lactating mothers, adolescents and girls, so that we try to reduce malnutrition and improve health outcomes. For governance and law, and financial and social sectors, all of these are very relevant if the health sector is going to succeed. So, for example, we passed our Gender Equality and Women's Empowerment Act in 2022, which was also a key priority of our president. And this ensures that women's representation is significant in all leadership and decision-making roles across all sectors, health sector, social sectors, financial sector, everywhere. So this has paved the way for a lot of gender-responsive policies in health, in infrastructure, in environment, agriculture, etc. Like very recently, we've passed the Child Marriage Act. We have an upcoming Safe Motherhood and Reproductive Health Act that's going to ensure, extensive services are provided to women across the whole country, irrespective of socioeconomic status. We're working on a Child's Rights Act, a mental health bill. Most of this legislature, I am proud to say, are being led by women, women in key leadership positions, because we understand what this will mean for the health and well-being of our women and our girls. And we're investing in a lot of social protective mechanisms, employment and economic policies which prioritize vulnerable groups, especially also focused on women-led households, particularly in rural and coastal areas, which are more prone to some of these disasters. So these are just some of the sectors. I mean, the education, there are many things that the country is doing, but I just wanted to highlight some of these as what we're doing in Sierra Leone to adapt to the climate challenges. For the health sector in particular, we are reimagining it so that it works for everyone, not just the men, but also the women, the girls, the children as well. So thank you.
Thank you so much, Honorable. I'm so impressed with what Sierra Leone is doing. You seem to be walking the talk by really driving comprehensive reforms, comprehensive investments, multi-sectoral approaches that really put women at the center. In this drive, what has been your experience in terms of maybe the response of men? Do they feel that we're putting too much of a focus on women? How have you carried men along as co-champions to these changes, these important changes that you're making?
Thank you. I think that's a very important question. And one of the things we've been very lucky with is the fact that our president is championing many of these initiatives. And I mean, he's the first man of the country. So I mean, he's actually leading the fight for women's empowerment, for gender transition across all sectors, not just for health, not just for climate, but across all sectors. So he's bringing the men along. But as co-champions of this fight, the women as well, we're also working with the men in our sectors. We're bringing them along, we're educating the men, we're telling them it's not an either or, it's not the men or the women or the men versus the women. We're making sure that our policies for health, for climate, for agriculture, for everything is inclusive for everybody. So what we're doing is righting a wrong. We're not creating a new wrong, for example. And I must say, under the leadership of the president, we have a lot of men who are in key leadership roles, like in parliament, in the law, in reform sector, who are also champions of this. We call them our co-feminist champions, who are also joining the fight, and they're helping us as women to drive some of these changes, to drive some of these policies. So, I mean, of course, we have some resistance, but we are not letting that take seed. We're paying no heed to any of those, and we're just fighting and bringing everyone along. We're talking the talk, we're walking the walk, and we're making sure everybody is on board. Whether you like it or not, this is happening in Sierra Leone.
Thank you so very much. And it's either by luck or by deliberate interventions or training. Apart from your president, you have so much male support in the direction that you're going. So did you include any interventions to build up this support from the men, or it just happened that these are men that were supportive of the gender equality agenda?
So we do have so we do have some men who've been working in this space for a while, right? In fact, some of them are key ministers of government. I would name like our Minister of Information, for example, our Minister of Health, for example, who's my boss. I mean, his main priority has been improving maternal and child health in Sierra Leone. So I mean, we do have men who've been working in this space, but I also want to say that because of the active engagement of the president and active engagement of women champions who've now been brought to the decision-making table, and the fact that we're not taking no for an answer, a lot of other men are coming on board. And because this work has been going on for the past few years, it's slowly, becoming the norm to see women like myself, who are young women who were not traditionally part of decision-making tables. It's slowly becoming the norm to see that these women are now taking center stage. And we're also shaping policies that will impact not just women, but I mean the entire society as a whole and our children as well. So part of the way we're also working to make sure that this change is sustainable is we're catching the men when they're young. So we're going into universities, we're invading schools where we're talking to boys and girls and showing them that what we're doing now, this is the way things should be. This is normal. And this is how other countries have made progress in some of the key policies that are affecting the health and well-being of their population.
Well, thank you very much. Very impressive. We'll still come back to the case of Sierra Leone. Lots to learn there in terms of the efforts that we've made. But I think the biggest signal is that the agenda is supported from the top. I think that's very important, and everyone else has aligned to that. I'm just going to move to our next speaker now. I'll come back to you, ma'am. Ms. Katindi CV. I mean, given the example we've heard from Sierra Leone around how they are building a very comprehensive, resilient health system that is gendered. What do you see are the key requirements for a sustained gender-just transition within the healthcare system that's long-term? How can we, as countries and communities, integrate foresight and futures thinking into health system planning and delivery?
All right, thank you very much, and it's a pleasure to be here. And I think just to answer your questions about the key requirements that are needed for that sustained transition, I think number one is to recognize that we are dealing with a very complex issue. And usually the way we've been taught to handle such matters, for example, for a long time, there wasn't this issue about intersections between health and other things, for example, or climate change and other things. But what is happening now because of the current challenges, we are beginning to see that those intersections exist. And so we need to move away from, the way we handle challenges, and we were taught in school to handle challenges as logical, from a logical perspective, like A plus B equals C, and to understand that, first of all, we need to think about those intersections, what they produce, and the complex things that come across, and then how to handle that complexity. And that's going to be very, very important. The reason I say that is because even when you look at the challenges that these issues present, they are quite difficult. And, one can be caught up, for example, and I've seen this in policy, where people are caught up in fighting the today. So, there's a famine every 6 months, there's, floods every so often, etc. And so we can be caught up in trying to get solutions for today. But the point to make about thinking about sustained change is to ask ourselves, okay, how do we, yes, deal with today's challenges that are recurring, perhaps, in more frequent ways, but also, but those will not stop. And so how do we divide our time between dealing with our challenges now and reacting to the today, but also preparing for what the future portends? And so that requires a level of preparedness. And one of the things I have seen in policy also is that we are very good at looking at the past, and we look at past challenges, how they've manifested themselves, and then try and figure out what the challenges or what the solutions will be. But foresight requires that you think about what are today's challenges going to present in the future, what are the implications of also things that we're not in control over, things around the world that are happening, other intersections that are also coming on top of, health, on top of, climate change, and on top of, other things, and particularly gender, and how do we then begin to anticipate those, what they will produce in the future, and then how do we handle even emerging challenges that are increasing more and more. So there's the element of looking ahead as well, so that we are also prepared for that future. I also want to mention that the long-term thinking is something that people imagine that is very expensive. But what I begin to say is that if you don't anticipate, reacting to those challenges when they come will even be more expensive. So we need to remove the fallacy around expensive. And I want to touch on a very interesting process that happened during the UN General Assembly. I don't know whether the people in this audience know that, of course, the Secretary General in 2020 came up with what is called a common agenda. And of course, during the UN General Assembly, the Pact for the Future was signed. And one of those things that became central to that future Pact for the Future is the question around doing policy and preparing for future generations. So that policies are not just looking into addressing the issues now, but also considering what are the impacts of what we do today on the generations that come after us, so that we don't disenfranchise them. Then in the same pact, there's a very interesting question that Aggrey Aluso touched on, which is the issue around finances. And of course, when you think about the financial architecture, one of the interesting things that you begin to see is, of course, and this is me bringing in the point around foresight cannot be done devoid of what has happened in the past. That our actions in the past, for example, when it comes to, the global South countries, we've been disenfranchised a lot because of, debt. The financial architecture hasn't been inclusive in itself. And so this has, implications on, for example, health systems. My country, for example, right now is doing almost 80% of GDP on debt. And so we have very little money. The left that is rest is for recurrent expenditure. And so what are the sectors that suffer? The first one is health and education. And that is where the disadvantages come when we see the nexus here. And so it is going to be very important for us to then revisit some of these global conversations and ask ourselves, how do we, make them more inclusive? How do we make them more just, so that we can be able to get that can trickle down to our countries, and that we are able then to provide the essential services that are needed. I could go on and on, but let me pause there, and we can do the next round of questions. Thank you.
Wow. Well, thank you so very much, Katindi, for really those insights. I think first and foremost, you are encouraging us not to box our thinking. Life does not exist in boxes. Everything is connected in the same way Mother Nature is connected, right? I mean, the land is connected to the water, is connected to the sky. And I think once we realize those interconnectedness and the complexity, we have to get humble about, and maybe more reflective about the responses that we are suggesting. I think secondly, you also touched on the fact that how do we actually balance responding to the challenges of today, the disasters of today, and planning adequately for the next 50 years, for the next 100 years. And I think on that one, I just want to go back to Honorable Minister Jalikato, just to hear how Sierra Leone addresses that balancing act when you're faced with a flood or drought. How do you ensure that the broader agenda on health system strengthening or overall resilience building is balanced with the here and now needs of communities affected by disaster? And then I'll come back to you again, Madam Katindi, on the financial question you raised.
Thank you very much. I think for us in Sierra Leone, we've learned some hard lessons when we had the Ebola crisis, for example, and also when we had, the COVID-19 crisis. And this has helped us to build, some structures or policies on how we respond to crises in general. In the past few years, we've faced a lot of climate-related crises, including mudslides. Just recently we had lots of flooding, lots of people were displaced, affected. And I am, happy to say that some of the hard lessons we learned during the Ebola crisis in particular helped us to respond adequately when we had the COVID crisis, and also when we had some of the climate-related crises. So what we're saying is, it's not again, in this situation, it's not an either or. It's not a juggling act, right? If the health system is built to be resilient and capable to respond to any emergency, any crisis, it should also be able to maintain, normal service delivery during this crisis. And how does that work? First of all, we make sure that even during quiet times, we strengthen service delivery, improve quality, address issues like energy, like water supply, like supply chain, so that these are robust enough to respond even during emergencies. We also tackle the health infrastructure, in general. Our ambulance services, our health facilities, making sure that they are capable enough to withstand climate disasters and respond to the emergencies, but also general provision of services, so that there's no interruption of services. So right now, as we're building our emergency response systems, our early warning systems, we're making sure to not build parallel systems. Even the climate health program, which is quite new in the ministry that we've established, we're ensuring that we're not setting up parallel structures at all. Everything, the emergency response, the climate system that we're building up are going to be integrated into existing health systems, so that as we strengthen or expand these services, they go along with general health service provision. So that if there's a flood, we can respond by providing emergency services, but we also maintain vaccination, we also maintain maternal health services, we also maintain cesarean sections, blood transfusions, and normal referral processes for people who have other problems in the health system. So, basically, we're balancing our investment so that it's strengthening the health system as a whole. And the bedrock of this is our primary health system, because we believe once we have a very robust, quality, inclusive primary healthcare system that permeates all communities across the country and ensure that they're inclusive and gender sensitive, these primary healthcare system would respond to emergencies and as well adequately maintain routine health service delivery.
Well, thank you so very much. I will just shift back again to Madam Katindi. Madam Katindi, you dropped a big one. We can have a vision for a resilient health system, but we need the financing. And if we have a case or several cases where African countries are paying 80% of their GDP to service the debt, then we're in no position to deliver a climate just transition, not a gender just transition. And linked to your earlier point about the intersectionality, we are paying debts back to countries we borrowed from, the countries that have contributed the most to the climate crisis. From where you sit, what is your recommendation on how we can shift towards more sustainable sources of financing to finance this transition in the health sector and broadly in our communities for us to protect ourselves from climate change? And maybe beyond the finance question, I would also want you to tackle the role of communities in dealing with these complexities. How do we get to invest more in community knowledge in shaping these climate resilience reforms?
All right. So in tackling the question of finance, I think anyone, for example, living in Africa would know that there's a lot of leakage when it comes to resources. So, for example, we have a statistic like, an equivalent of 20,000 $20,000 leaks every day, from public finance, issues. And that's quite a lot of money. I mean, if you're to quantify that for a year, you can imagine how much that would do for, provision of public services like health. And so we must really go a long way in combating corruption. And I don't think anyone should wait for government to do that deliberately. And this is where I tie my submission to the question around what can communities do. I think if you've been following the news on the question around public finance, Kenya, for example, which is where I am from, you remember just around June and July, we had a finance bill that was produced, and it was proposing quite punitive taxation measures. And young people just went to the streets and decided, you know what, it cannot continue like this. And so this is a case where the public is well informed about their rights. It's well informed about, participating in budgeting processes. And that process then, enabled, or pushed the government, in a sense, to withdraw the public finance bill. And that's a classic example of what citizens can do to also push back on some of these things, because we are witnesses of also the fact that the resources are not being used prudently, to provide the services, and there's quite a lot of leakages. I think the other question is to really think about our own internal financial architecture, if you may. So you think about a lot of the resources, and I can say this confidently in most African countries, is that the people that are working and sustaining revenue, because a lot of it is from taxation, is a very few people. In my country, it's about a third of the population, 30%. And you can imagine only 30% of the population, bearing the burden of being able to raise resources through taxation. That's not sustainable. And so how we can creatively and imaginatively think about, involving the informal sector without being punitive is also an important one. And, trying to raise resources in a prudent manner, using those resources prudently and making sure that that is spread, across. But then, of course, we have to address many other complex issues that like unemployment, because you cannot raise resources where there is such massive unemployment and there is quite a lot of dependency within households. So there's that complex bit about the internal finances. But then when you look at the global sector, then, of course, there are questions around how do you then have a lot of the countries that we're talking about are completely unable to pay this debt. So how do we negotiate either debt forgiveness or restructuring to be able then to have these countries, get reprieve and they can be able to. And I really like one of the sentiments that came out, that it's not about numbers, it's about people. How do we just sort of like balance all those expectations? How do we manage borrowing, from our countries so that we are not also borrowing for recurrent expenditure, but we are borrowing for development? I just was teaching a class the other day, and we got to hear about Singapore and how they have structured their finances, and that the law actually provides for the fact that they cannot borrow if it's not for development. But African countries are borrowing, for recurrent expenditure. That has to end so that we can sort out the mess that is there and that we can transition to provide public services. Thank you.
Wow, thank you so very much. Mr. Hashim, I have not forgotten about you. I'm coming to you shortly. I think Katindi is on point on the finance question. As the African citizenry, we have to be stronger on stopping corruption because we need every dollar. We have to look at internal, local, national financing options, because the terms that we get in the global financial architecture are part of what is unjust. The risk rating for any African borrower or African country borrower is higher than others, and yet there's still loads of opportunity here that investors still come to Africa to extract. Lastly, I think the point about the impossible, I think the issue around debt is an urgent one. As long as it remains unresolved, we will not be able to deliver the resilient and climate just health systems that we are aspiring for the future. Now, our last but final speaker, by no means least important, is Mr. Hashim Hook-Patin. Hashim, I'd like us to speak to the realities of women as they comprise 72% of the health force in Africa. How do the core principles of the transition, such as dignified jobs, freedom from gender bias, and valuing their care work, how can the invisible and visible barriers they are facing be taken into account so that the overall transition is supported? How do we get a more fit for purpose workforce that eliminates the biases and the barriers women in the health sector still face, whether it's a point of view of unrecognized care work, whether it's from the point of view of no secure guaranteed employment, or whether it's from a point of view of general biases at the workplace? Over to you.
Thank you very much, Nachilala. You mentioned that 72% of health workforce in Africa is women, and that figure may fool us into thinking that health system is performing better than other systems as far as gender is concerned. But scratch beyond the surface and you will uncover stories that are hidden behind that figure. Three of them, from my perspective, of main here is that healthcare is a reproductive labor, and as such, in our current way of living and thinking, it's not valued. And then it doesn't gender just principles and health work are not well. The second story that we live we are in a system labor and held by women also here, and that configuration put them subject to the power relations that we can have.
Hashim, is Hashim
The
breaking or
health
is it my?
system.
Can everyone hear Hashim okay? Can everyone hear him fine?
Can you hear me?
On my side, you were breaking, but it could be my internet, but carry on. Oh, okay. You're breaking
okay.
up to others as well.
Okay. So the first story, so the first story was about healthcare as a reproductive labor. The second is that we in the health system have a lot of unskilled and low-level positions held by women. And third, are struggling force retention, and that.
Hakim, maybe turn off the video so that we can save a bit of bandwidth. Hakim, Hashim? I think we've lost Hash.
Can you hear me better now? I've switched
Better.
my. Okay, good.
Okay,
So,
better.
so I was saying that the 72% figure of women being 72% of health workforce being women may fool us into thinking that health system is performing better than other systems. And then we need to scratch beyond that figure and uncover stories that are hidden behind that figures. And the first one would be the story of healthcare being a reproductive labor and not valued as a productive labor will be in our way of organizing our societies. The second being that we in the health system have a lot of unskilled and low level positions, mainly held by women in Africa, and then subject to the power relation inherent to workforce categories. And third, the continent is struggling with health workforce retention. And it is important that we, in the way we approach the problem, do not replicate the mental model that led to the gender unjust situation we are in currently. So we need to also acknowledge that having to play a provider role, male are mostly the gender that migrates to fulfill that provider role. And then their mental health is also at stake in that configuration. So coming back to your question, steps necessary to infuse gender just transition in the health sector. For me, the first one and most important maybe is acknowledging that health system in Africa are not failing to deliver gender just outputs. Truthfully, they have never been designed to deliver gender just outputs. As the saying goes, the purpose of a system is what it delivers, not what it fails to deliver. So health systems in Africa have not been designed, were not designed to deliver gender just outputs. Second, in my opinion, and that clicks a lot with the experience that has been shared from Honorable Jalikatu, health system does not work in isolation. It is the product of the context in which it is, including historical path. And we are in on a continent that is in a crisis of identity. In a crisis of identity, scattered between its knowledge systems that have been killed, silenced, annihilated, and devalued, and the push towards globalization, a push towards more uniform than power imbalance worlds. So we have the Universal Declaration of Human Rights, but still a very few countries hold veto right at the security of the UN. So that crisis of identity impacts also the way we approach concepts like gender. Yeah, the concept of gender role is still blurry on the continent. And third step that should be considered, in my perspective, is about value. What do we value as human community, as global community, as African community? What are our values? In the economic system in which we are, most of the countries are, we value profit above people. And it is maybe also high time to ask ourselves whether we have lost humanity, we have lost compassion, we have lost love to our siblings, people, our global and African community, human community, because most of the issues here comes down to having compassion to the other people. So in my perspective, those are some steps that are worth taking if we are to consider moving toward gender just transition in the health system, in African health system. Thank you.
All right, thank you so very much, Hashim. I think now we're going to move to addressing some of the questions. Some of them already touched on by various speakers that have come from our audience. Audience, thank you very much for your question. So the next question, I'm going to address it to Aggrey. It's related to the point around how we can practically move towards a gender-just health system. There's a question in the chat in terms of how do we engage men effectively to encourage them to participate in ensuring a sustainable and gender-just future health system. What would you like to comment on that? We really do not want to leave the men behind. We want the men to feel vested. We want the men to feel there's something to be gained. What points can you raise in terms of how they could be involved in the advocacy, either at the community level, at the national level, or at the global level?
Thank you. Thank you, Mudut and fellow panelists. I think this has been very rich, interventions so far. And just moving on to that question of how we can practically move to gender just, health system. I think, of course, in the climate context, I think what the minister from Sierra Leone presented, I think, is really the way to go. Is the example of what you need to make substantive change. I think it really needs leadership, political leadership, and those who are currently in positions of leadership have to be pushed. I know sometimes, a lot of times, we rely on goodwill, but as an advocate, I know goodwill is not guaranteed. It's not bankable. It's not accountable. But if you have a leader who has such goodwill, like the president of Sierra Leone, I think It's something to institutionalize and make part of our normative systems. That it's not it's not something that we chance upon. It's something we build deliberately and understand why it's important, and build our systems to really be geared towards delivering that gender responsive outcome, recognizing from where I started my intervention previously, where the problem is coming from. So we really need to problematize this unjust arrangement as a problem in the definition of the challenges of what we prioritize as issues in our country. And that needs to be the political definition of priorities. In our political conversations, we need to make this as part of the issues we ask from our government. It needs to be part of what we prioritize when we are talking about health system reforms. So in the whole, conversation around UHC, all these conversations around health workforce reforms, we need to bring this understanding of how the differential impact of climate change, in terms of how women and girls experience the health system, and therefore how this health system need to be reformed. So political leadership and driving political accountability are things that are very important. Identifying the policy gaps that needs to be addressed, because in all the institutional arrangements, there are institutional systems that create and sustain this unjust system. So we need to actively challenge that, identify what they are, and really identify the structural drivers of this unjust arrangement, and work towards correcting that. And then, of course, what we know is that if we don't maintain the momentum by really bringing the different formations of movements to prioritize an issue, then it falls through the cracks. It doesn't register in the radar of the political priorities. So as an advocate and as a Pandemic Action Network and Resilience Action Network, we really value collective action. Networked advocacy is a tool we use. And this is not an issue of women. And a lot of times when we talk about gender issues, people want to make it, somebody had asked that question, you want to make it an issue of women and girls. The unjust arrangement that we're experiencing is a creation of the systems that actually it's most of us men who create this unjust arrangement. The patriarchal arrangement that Nashilala talked about at the beginning of this webinar really is where this is anchored. And we have to identify that and dismantle it from its roots. So that's why I said we need to identify the structural drivers, which are the patriarchal arrangement. And these are manifest in very many facets of our society, cultural, religious, and the policies that we make. A lot of them are very gender biased and gender insensitive, and just anchor this unfair arrangement and perpetuate it. So we have to really be intentional on really breaking that. So collective actions, bringing different formations of stakeholders, those working on health, those working on gender justice, those working on human rights, to be advocates, talking the same language. And those working on climate change, because we've seen a lot of times, many of us working in this non-government or CSO sectors, we have different access to government. Some issues are prioritized and we are happy to just go along and deal with ours and forget about the others. I think we need to cross-pollinate, so to speak, so that everybody, all the different formations of civil society organizations have the same connected agenda, because this is about the whole of the person. If you don't have, if you don't address these issues, whatever we are doing will be suboptimal, because we know the importance of everybody. Women are more than half of the population. If we have systems that don't serve them, they are the anchor of the health systems. They are the ones who are, nurturing lives and bringing forth new, human beings. If you don't support them, then humanity is doomed. We really need to get that across and get everybody to prioritize that, so that it's not an issue of certain groups or certain genders. It's everybody's, agenda, and it's for the benefit of everybody. And then we need to have sustained action.
Aggrey.
Yes, thank
because
you.
we're almost getting to the tail end, so that we get others a chance to add. But thank you so very much.
Let me pause there and leave other points for colleagues to say. Thank you. Yeah.
Yes, but your points are very much on point, very practical action on how we can take this conversation forward. There was another question from the audience, and I want to bring it to the Deputy Minister. Given the success of Sierra Leone, in your view, what is the most sustainable way to finance this gender just transition within the health system, in view that Hasim reminded us that the health system originally were not created with the gender justice outcomes in mind? So how are you financing the transition in a sustainable way? What difficulties are you having? And maybe what lessons have you learned? Honorable Mustafa?
Yes, thank you. So I should say it's not been easy. I think one of the things we had from Katindi is that African countries, including Sierra Leone, were already in huge debt, for most of our policies and even for recurrent expenditures, and Sierra Leone is not any different. So for our health system, for example, we have a per capita spending on health of about $46. And majority of this, probably $40 or more of this, is coming from donor funding, our international and developmental partners. And less than 5 is coming from government sources because, again, the country is struggling with domestic revenue generation, and it's heavily reliant on taxation. Same thing like Katindi said, the population who can actually bear the burden of this is very slim because a lot of our workforce is in the informal sector. So just to say that it hasn't been easy and climate policies or climate health policies specifically, it's a new conversation that Sierra Leone has started having in the past 1 year or so. So getting funding for something that's new, but also considering the context of many competing priorities, many competing health priorities in Sierra Leone, it's been extremely difficult. But one of the things that we've banked on is the fact that this is a multi-sectoral problem. Okay, so it's not just a health problem, like we've mentioned. The investment is not only going to be in the health sector, but in many key sectors, which when you put all of this investment together, is resulting in positive changes in the health sector and in empowering women, which translates into better health outcomes for women, girls, and children. So, as much as the health sector's financing from government budget is not adequate, I mean, this is the same across many countries. But when you put together all of the investment that the government is doing in areas of water and sanitation, energy, social protection, agriculture, and the fact that these investments are translating into positive outcomes in terms of the gender transition for healthcare, I think we can say that what we've seen the biggest impact and most sustainable way that we're making these changes is from government support. Donor and international partner support is important. Yes, it's helping us address some of the vital and urgent needs that we have in the health system. But what we've most often seen is that some of these support, they come in with already fixed agenda, and it's very difficult to change the agenda. It's very difficult to align some of this support to what the country's priorities are. And as I said, many of our climate health problems or priorities are now emerging, or they might have been there, but now is when we're talking about addressing them. So they're mostly not aligned to existing donor support or donor financing. So as much as this support is helping us, build structures in the health system specifically, but again, it's difficult to align them to new priorities of climate and health. So one of the ways we're tackling that particular problem is, like I said, just to make sure that all the climate health policies or interventions that we're building, including making sure it's gender sensitive, we're integrating them into existing health programs and in existing health system and support. So we're saying, we're not building new health centers that will focus on climate health priorities or women's health priorities. We're saying the existing health centers that we have, which are already being supported by government, by donors, by international partners, let us make them more robust so that they continue delivering vital healthcare services, but also now with a specific focus on climate health priorities and women's health priorities, making sure the two intersect, and it provides healthcare, along the entire spectrum, the entire gender spectrum, that's women, boys, adolescents, girls, or children. So that way, we're leveraging on existing support that is mostly coming from donors and using this to build the transition, I should say, in the climate health space. Again, because of the successes we're having, and we're articulating these worldwide, and we're getting more people interested in financing some of the initiatives we're doing in Sierra Leone, and including using these also to advocate even to the government, that we need more support and more resources for the health sector in this climate health space. One key thing I wanted to say, because somebody mentioned health not being a priority in climate and conversations in climate adaptation plans, in nationally determined contributions in most countries, is for us, we're changing that now. So we're working very closely with the Ministry of Environment and Climate Change. In fact, they've become our best friends. So we're working very closely with them as we're developing new climate adaptation strategy and NDCs for Sierra Leone, that health takes center stage in this. What we're telling them essentially is that health is the human face of how climate change affects our populations. So we're ensuring health takes center stage in this, so that whatever support comes to the country to address climate change in general is also really focused towards the health system and in supporting some of these transitions that we're working on here. Thank you.
Wow, thank you so much. And really, we're just hearing progress after progress, at least in the African context. Health has to be at the center of our fight against climate change. I'm going to ask the next question, and perhaps to our colleague Hasim. There's a question in the chats where the audience would like to know, and any of the panelists actually can answer this question on specifically how climate change is driving distinct vulnerabilities for women and women. What are these specific challenges? Maybe we know more about women, but less about men, and what is being done to address them. So I was going to ask Hasim to come in to just share as a medical doctor. What do you see on site? What do you see at the clinic? What do you see at the hospital?
Thank you very much.
And
Are
from
you
an
able to hear me?
institutional point of view, how are we dealing with this? Yes, we can, so that we don't have the same problem that was there before. Maybe you can switch off the video.
Okay, so I'll start if I have any. So in this discussion, I think we mentioned that climate change is worsening gender inequality and even health outcomes in general in Africa. And we can imagine from that sentence that everything that we know about let's say, before situation is worsening in terms of gender. So when we disaggregate a little bit, and maybe before entering that into that, it is important to stress that data is still problematic in Africa to understand, to really answer to that question with precise figures and information. But what we know for sure is that we are having worsening communicable diseases. The past few years are very enlightening in that regard, with the pandemics that we are having, the epidemics. Currently, we are having Marburg in Rwanda, Mpox, zoonotic diseases. So we are hearing more and more about those diseases on one hand. And as also stated here, when a crisis happens, often in a society, it is the most vulnerable people that are most affected. So you can imagine that if those vulnerable subgroup of the population are girls and women, they will be probably the one most affected. Adding to that, in general, when we have climate hazards, drought, flooding, etc. Still there, we have impact on infrastructure, healthcare infrastructures. So they may not be able to deliver services the way they used to. And they add burden to gender role and impact health behavior of women. And maybe to wrap up and say something about male also. Whenever we know that health-seeking behavior are biased towards male, they do not seek healthcare when they are in crisis. And we know that when we have climate change and its impact on health, that subgroup of the population as well will be less prone to seek healthcare. Thank you very much. I will wrap up there.
Well, thank you so very much. I just want to take this opportunity before Johanna comes in to close to really profusely thank all the panelists for sharing incredible insights in terms of the implications and requirement of a climate just, gender focused transition within our health systems in Africa. What I heard from all panelists is that this is a transition that's much needed and it's urgently needed. What I also heard from one of the panelists, Hasim, is that our original systems were not designed to deliver gender-sensitive health outcomes, so we need to do something about it. I also noted that we're dealing with a very complex issue with so many intersectionalities, and therefore we need to have that humility and thoughtfulness as we design the responses, because we need to correct some of the historical injustices that vulnerable communities are currently facing, but also we need to find new ways of making sure that women's issues, concerns, and experiences are more visible. Lastly, but not the least, I want to end my remarks by really saying that I think Sierra Leone is leading the way in terms of some of the practical measures that can be taken to try and build this resilient and gender just health system that deal with some of the pressing issues that we're facing currently and the ones to come in the future. So thank you so very much for your time. I'll ask Joanna to give the final closing remarks. Joanna.
Thank you so much, Nachilala, and to all the panelists. I think, I've been listening very intently, taking lots of notes. So much was covered today. And I think really touching on critical issues that need to be brought to the forefront in this conversation, at this intersection of climate, gender, and health. And I think it's been a real privilege to have you all sharing your views and your thoughts as part of this discussion. And we need to think about what next. And I think this is where the community of practice, is about bringing together, different actors on different topics. But then I think it's about what next, and beyond drawing on lessons and learning from different contexts and different perspectives, how can we work better together? So just a real, big thank you to everybody today, also to the IIGH team, comms team, and my colleague Arthur Saitabu, who's led a lot of the coordination and behind the scenes work. We, greatly appreciate you. And I think before everyone logs off, we've managed to keep to time, and we had extended this to 90 minutes based on everyone's request to move beyond 60. So I wanted to highlight two other webinars that are upcoming, if I may. The first is actually happening on Monday, the 28th of October. It's a UNU-IIGH webinar, continuing on this theme of climate change and climate action and health, and very much encouraging you to register. We have experts and activists from UNU-IIGH, our climate justice lead, Amnesty International, someone from Planetary Health Equity, Hot House, Friends of the Earth, ACT Health Promotion, and they're going to be exploring how health systems can lead the change against fossil fuels, particularly, in this context of commercial determinants of health. So please, we'll drop the link to register in the chat. And then just to say, our last webinar for the community of practice will be happening in December, and we'll share more details It's going to focus on gendered workplace violence in the primary healthcare workforce, and will build on from an earlier webinar IIGH had hosted looking at policies and frameworks for action. And that webinar in December will look at gendered workplace violence from the perspective of experts working in Burkina Faso, South Africa, and Tanzania. So we'll share more details soon, but just a big thank you to everyone once again for joining, and to the distinguished panelists, and Nachilala also hugely for moderating and presenting. We really appreciate it. Thank you so much.
Thank you so much, and all the best.
Thank you, everyone.
Thank you.